Hypertension is a highly prevalent chronic cardiovascular condition seen in about every 1 in 3 adults in the UK. It's characterised by persistent raised blood pressure above approximately 140/90 millimeters of mercury, when ideally normal blood pressure should range from about 90/60 to 120/80. Most people who have high blood pressure are unaware of it due to a lack of signs and symptoms, leaving many undiagnosed and 4 in 5 patients without their high blood pressure under control. In the more severe cases and in the cases that are left untreated for a sustained period of time, there are some noticeable symptoms which can involve headaches, nausea, fatigue, chest pain and anxiety. Sustained high blood pressure can also lead to more lethal complications, and considering its extremely high incidence levels, it's a leading cause of morbidity and premature mortality in the UK and across the world. Primary or essential hypertension is the form that 95% of patients have, and it stems from a combination of several different associated risk factors, genetic and environmental, which can all play a role in developing the condition. Some of the most common environmental risk factors include smoking tobacco, physical inactivity, obesity and high blood sugar levels, for example from an unhealthy overconsumption of foods. With the current obesity epidemic, it may seem evident why better research into hypertension to tackle the condition is critical. Most environmental risks are modifiable and can be prevented through lifestyle changes, however genetic risk is non-modifiable. Family history of hypertension is often a good indicator of the likelihood that an individual might develop primary hypertension, with several loci and genes having been identified that predispose the condition. Age is also a contributing factor, with more than half of people over 65 having high blood pressure. This poses a big problem as hypertension is on the rise due to aging populations, which again stresses the need for constant bettering of research. Secondary hypertension, on the other hand, stems from a known pre-existing medical condition, like chronic kidney disease, Cushing syndrome, thyroid problems, or diabetes. Monogenic hypertension, whereby there is a clear, singular genetic defect that causes hypertension, is also considered to be a secondary form of hypertension. Increased blood pressure in blood vessels may arise for several reasons. For example, increased smooth muscle contraction causes constriction of vessels, and thus there is an increased level of force of blood against the vessel walls. This is seen in kidney disease, for example, where an increased level of angiotensin II causes both vasoconstriction and an expansion of the extracellular fluid, and subsequently raises blood pressure. As a result of persistent elevated blood pressure, patients can face a number of complications and an increased likelihood of developing further conditions and disease, particularly involving the brain, heart, vasculature, eyes, and kidneys. Many of the complications that arise due to hypertension can be life-threatening. The incidences of cardiovascular diseases, like coronary heart disease and heart failure, have an extremely high correlation with high blood pressure. In heart failure, the heart struggles to eject blood against the high arterial pressure, which can lead to cardiac remodeling within the left ventricle, which consequently manifests heart failure. Hypertension is also a primary cause of stroke. This occurs due to high blood pressure causing the hardening and narrowing or atherosclerosis of vessels, which makes blockages more likely to occur, preventing blood flow to the brain. Other complications that can occur due to hypertension include chronic kidney disease and dementia. The evidently large burden that hypertension has on society makes it necessary to further our knowledge and continually research hypertension, and the use of animal models to do this is essential and is a topic that will be further explored in this presentation.
I am going to discuss the purpose and the range of animal models that are used in modelling hypertension. The purpose of animal models is that they are used to provide further understanding of the pathogenesis, prevention and treatment of hypertension. These models allow researchers to investigate the responses and quality of the response of the animal models to specific therapy and enabling interpretation of these results for human responses for each therapy to ensure the best outcomes and ensure that there are limited side effects. Results in animal models are collected and compared to ensure the validity and quality of the studies, ensuring results and experimental design are reproducible and appropriate. Animal models that are used in modelling hypertension are usually based on etiology. Renal diseases, including renal arterial stenosis and other systems, have been devised to examine the pathophysiology of renal parenchymal hypertension, renal ischemia, and perine fibric fibrosis. When selecting the most appropriate animal models, several factors must be taken into consideration. Factors to be considered include research scope, objective of research, access of resources, experimental cost, animal welfare, and practical sustainability. This helps keep ethical issues to a minimum and helps the research get much out of the animals as they can. The use of small and large animals both have advantages. However, small animals are more commonly used, e.g. rats and mice, with rats more common than mice. Smaller animals are usually used as they have a higher reproducible rate, as well as being cost-effective and good at representing hypertension. Small animal models, mice and rats, are most commonly used. They provide insight into hypertension pathogenesis. For example, activation of renin-angiotensin-aldosterone system and genetic factors of the disorder. Small animals like mice and rats have many advantages over large animal models. For example, they have a short gestation period and tractability for genetic manipulation. These models are also readily available to test precise genetic alteration techniques through either the whole body or cell-specific experiments. This helps to identify possible targets for new therapies. Another advantage for using rats or mice in the range of genetic strains, which exhibit robust, spontaneous hypotensive phenotypes through induction by environmental and genetic conditions. This makes them available to aid investigation of both genetic and metastatic bases of hypertension. The main type of rats that are commonly used in modelling hypertension are SHR, or otherwise known as spontaneously hypertensive rats, to measure effects of possible therapies on essential hypertension. Transgenic strains, consomic and congenic strains combined with gene knockout techniques have been used to examine the metastatic basis of essential hypertension. Large animal models are sometimes used, but this is much rarer than the use of small animal models. Large animals that are used in hypertension investigation include swine or pig, sheep, and non-human primates or monkeys. The use of large animals have their advantages as their anatomic, physiological, and hemodynamic similarities are very specific with hypertension, especially when compared to small animal models. Their main advantage is linear studies of hemodynamic consequences of long-term blood pressure elevation. However, along with these advantages, there are many disadvantages that come along with using large animal models. A major disadvantage to using large animal models compared to small animal models, other than cost, is that there is limited availability of genetically modified animals of hypertension due to maintenance cost, longer reproduction cycle, as well as experiments being very labour intensive.
We can monitor blood pressure in animals in multiple ways. For large animals, such as dogs or sheep, invasive methods like the arterial catheter can be used. An arterial catheter is a needle or hollow tube that is placed into an artery. This arterial line is hooked up to a pressure transducer. Whenever changes in pressure occur, the pressure transducer converts that change into an electrical signal and sends to the monitor where the blood pressure can be read. Non-invasive techniques can also be used, most common being the oscillometer technique. In this method, a cuff which is connected to a monitor is placed on the animal's limb and pressurized to the point where blood flow is restricted. The monitor can read the rapid increase in oscillation when the cuff is pressurized and the rapid decrease in oscillation when the cuff is relaxed. This gives us both systolic and diastolic pressure. For smaller animals such as rats and mice, occlusion tail cuffs can be used. This works in a similar way to the centimeter technique. The animals are strained and the cuff is placed on the animal's tail. The cuff uses volume and pressure recording sensors to determine the animal's blood pressure. The cuff is also connected to a monitor where the readings can be seen. There are multiple animal models of hypertension. These models are split into two types, the primary models and the secondary models. The primary models focus on inducing hypertension via genetic methods. Inbreeding and gene knockout methods can be used to achieve a strain of naturally hypertensive mice. We already have a strain of naturally hypertensive mice, which was created via inbreeding in the 1960s and is widely used today. In secondary models of hypertension, external factors are used to increase the animal's blood pressure. These factors can be environmental ones, such as placing the animal in cold temperatures or shaking the animal. It is also possible to induce hypertension via corticoid injections and other methods, such as the constricting of renal arteries. Dietary methods can also be used. For example, if an animal is placed on a high-salt diet, its blood pressure will naturally increase over time. The secondary models, however, are not likely to be used as they can induce extreme stress in animals. A possible alternative to animal hypertension models would be the organ-on-a-chip model. The organ-on-a-chip model aims to replicate a certain organ environment in our body. This is done by creating replicas of units of an organ system using a microfluidic platform. These chips focus on one area of the body, such as the heart or lungs, and use stem cells to recreate cells native to the system's organs. This technology can potentially replace animal models as primary testing platforms. However, currently there are many issues with using these chips in preclinical testing. One of the main reasons being is that the chip organ only mimics a secluded part of the body. Therefore, it is impossible to predict interactions of the selected organs with other parts of the body. These models are also always in highly controlled environments, so external validity of tests performed in these chips will be low. Organs and chips also currently struggle with traceability and scalability. There haven't been enough tests performed on these chips to guarantee that everyone using them will have the same quality of data. Similarly, we do not know if these chips will show the same responses to drugs that would occur in our body. Due to these problems, animal models are still the go-to method in preclinical trials and scientific research.
When using an animal model, there are multiple criteria that need to be assessed in order to deem if it is a good fit to use to model the disease. There are three main ways in which we evaluate this: construct validity, face validity, and predictive validity. I will explain how these three concepts can be used to evaluate animal models of hypertension. Firstly, construct validity is a measurement of how similar the origin of the animal model is to the origin of the disease in humans. All models of hypertension have limitations in their construct validities. There are obviously huge differences between animals and humans in many aspects relating to onset of hypertension, including anatomy, genetics, physiology, and surrounding environments. There are many different causes of hypertension and therefore hard to replicate accurately in animals. This is why larger animals have been used in hypertension testing, as they have higher genetic similarity to humans and thus carry a greater degree of construct validity. Additionally, blood pressure in these animal models during procedures could be altered due to the techniques used, for example anesthesia, as well as stress and pain from the experiment, which would consequently compromise the construct validity. The face validity regards how closely the phenotype of the animal model is to the phenotype of the human disorder. Every animal model of hypertension has a degree of face validity due to every model showing an increased blood pressure, the main symptom of hypertension. Other phenotypic factors of hypertension can include age of onset, variability, severity, and associated comorbidities, which can vary in different animal models. Some models, such as the previously mentioned spontaneous hypertensive rats, as well as salt-sensitive rats, are able to provide greater face validity for organ damage due to hypertension. For example, left ventricular hypertrophy, heart failure, and strokes caused by hypertension can have their responses reproduced accurately in these models. As of yet, there are not many models which are able to accurately reproduce the symptoms and behaviours of other conditions related to hypertension, such as myocardial infarction and arteriosclerosis. The final factor to take into account when assessing whether this animal is the best model of the disease is predictive validity. Predictive validity relates to whether the animal model will be able to predict if a drug will be effective in humans. The predictive validity for hypertension animal models depends on whether the drug is being used for hypertension research or management of it. One problem using animal models for hypertension is that a lot of ways of maintaining the intended blood pressure in humans are related to behavioural issues, for example smoking and diet. Therefore, animal models would not be useful in predicting the outcome of a therapy unless these behavioural issues were eliminated in humans. However, if we were to look into resistant hypertension, animal models could provide some significant predictive validity. Development of new drugs and therapies for this would be helpful where other conventional therapies have been proven not to be. This is where predictive validity would be higher, as we are focusing on the effect of new drugs on a similar animal model, which could provide new valuable information. Lots of drugs which have passed through trials in animal models have then failed to go further in clinical trials due to not being effective in humans. However, for animal models of hypertension, all antihypertensive drugs have been shown to go on and lower blood pressure in clinical studies. All common animal models of hypertension showed a significant lowering of blood pressure also after the same drugs were taken, therefore a greater predictive validity is seen. As there is an obscure pathogenesis for hypertension, it is cautioned not just to use one animal model to predict the outcome, and also best to use an animal model which is able to mimic any further complications of hypertension which can arise.
Using animal models of hypertension is useful for biomedical research. First of all, some animal models have similarities to humans. This makes them suitable as they have similar anatomy and physiological functions as humans. For example, mice share 98% of DNA with humans, and chimpanzees share 99% DNA with humans. Allowing experimental animal models of hypertension have given us lots of information on the pathology and complications of the disease. This allows us to test the efficacy and mechanisms for different drugs. Secondly, it is practical. The management of animal models of hypertension is quite easy. For example, you can control dietary intake and many other environmental factors such as temperature. This allows a lower chance of environmental variation when comparing human studies. A lot of animals also have a short lifespan in comparison to humans. This means they can be studied through their life cycle. Thirdly, animal models of hypertension can be used to test the safeness of drugs. Before clinical trials with humans, the drugs must be tested pre-clinically on animals in order to assess the toxicity testing, pharmacodynamics, pharmacokinetics of the drugs used for treating hypertension. This is important before clinical trials, as you can determine the dose needed to be performed on the humans without producing too much adverse effects. It is unethical to directly test drugs on humans without knowing the drug profile and effects. There are many arguments against using animal models, as they are shown as being unethical. The animal rights are violated when they are tested for research. A philosopher professor, Tom Regan, from the North Carolina State University, he quotes that animals have a basic moral right to respectful treatment, and this inherent value is not respected when animals are being reduced to being mere tools in a scientific experiment. Animals should be treated the same as humans, as they both feel, think, behave, and experience pain. When animals are being experimented on, most often the outcome is pain, permanent damage, or death. They don't get to choose whether they want to participate or not. Tom Regan also implied that animals shouldn't be sacrificed just for the advancement of human technology. We shouldn't decide their fate just because they cannot vocalize and express their own choices. There are also many other alternatives that we can use instead of using animal models. These include in vitro methods, computer in silico modeling, and human patient simulators. Animal models are very expensive. They can cost between hundreds of thousands of pounds to millions of pounds. Analyzing and testing animals could take between months and years. You have to take care for the animal over the years, provide food and water, and you may also need specialized equipment which could be expensive in testing animal models. In our case, this is hypertension, but overall, it is expensive to have animal models.